Hello and welcome to IOSH Magazine's roundtable on health, mental health and well-being. I'm Louis Worsterman, IOSH Magazine editor. Employers in the UK have a direct responsibility for looking after employees' health in the sense that they're preventing diseases and providing health surveillance. But I think it's fair to say that interest has gone a long way beyond that in recent years, and it's become one of the kind of zeitgeist employment topics. It's 10 years since Dame Carol Black published her first report on the mental health on the health of the working age population. Since then, we've seen the government launch a Fit for Work service and then withdraw it. But employer interest, driven partly by the ageing population, by sickness absence levels, and perhaps by a general sense of corporate responsibility in some cases, has grown over that period. Just look at the growth in mental health first aid as a provision in the last few years. To discuss how best employers can work in this area and support employees' health and well-being, I'm joined by experts from 4 organisations that work in this area, and we will talk for the next hour about, as I say, what employers can do best and what are the pitfalls of health and well-being provision. So if the panel would like to introduce themselves, James, will you start?
Yeah, hi. Thank you, Louis. I'm James Mansbridge, and I'm the Head of Digital Learning for the British Safety Council.
And I'm Helen Smith, Chief Commercial Officer at Bendon Health.
I'm Alexis Powell-Howard, Managing Director of Fortis Therapy and Training.
I'm Caroline Yeoman. I'm an organisational psychologist and Ops Director of Oak Wellbeing.
Thanks very much. So I'm going to start with a very basic question. Why should employers prioritise over anything else that they could spend money on in health and safety and HR? Why should they prioritise employee health and well-being? Carolyn, will you start?
Yeah, well, we know from a lot of research that's been done by the government, by places like Engage for Success movement, which is government funded, we know that there's huge business benefits when we start to look at well-being. And so certainly if we can take a strategic approach to well-being, we can demonstrate at all levels that return on investment. And I think that's been traditionally the problem with the whole well-being area, is that organisations tend to think that they can't measure it and that it's not really a good return on investment and it's quite intangible, and actually it's not. So we know that when we look after and care for our staff, they're more productive, they take less time off work, there's less presenteeism. So I think the business benefits are there now, and the research is there to back that one up.
Thanks. Alexis?
I agree. I think that employers are beginning to recognise that actually their resource is their people. And if the investment isn't there for the people, then we get all the problems with the different impacts on culture and the absenteeism rates, presenteeism. And I think that, actually engaging their people in being able to look at what they need, not just assuming what they need, is also part of it. And I think also recognising there isn't really a quick fix. It has to be something that's part of a systemic approach.
Thanks, Helen.
Excuse me, yeah, I'd absolutely agree with that. I think the companies we work with that have a really strong and well-embedded health and wellbeing strategy are the ones that have a real desire to be a high-performing company, to increase their productivity, and just to be competitive in the marketplace. So it makes just really good business sense as well. Your people are your greatest asset, and having the best people, recruiting the best people, retaining the best people, and having those people fully engaged is absolutely one of the most critical things for a business to survive in today's environment.
Thanks, James.
Yeah, I mean, if you look at traditional health and safety, we're far safer now than we ever have been. Fewer accidents at work, fewer deaths in the workplace. And if you look at absence rates, it's things like stress and anxiety that are the biggest cause. So therefore, it's absolutely essential that you invest heavily in that, because if the battle for safety has been largely won in this country, certainly when it comes to mental health and well-being, we're just beginning.
What would you say to an employer who said, my responsibilities don't stretch that far, that's not a productive use of corporate funds or that the state should be providing in that area through through corporate taxes or whatever the government should be providing through the NHS, those kind of services.
I mean, certainly I'd say, even from a legal point of view, you're responsible for the welfare of your employees, and I would suggest that welfare encompasses the mental health side of things as well. But there's huge benefits to investing in it as well. Companies that have done this and measured it have shown huge return on investment. One of the companies we've worked with, I think it was, they said for every £1 they spend on wellbeing, they get £7 back. So from that point of view alone, it's definitely worth to invest.
Does anybody else have any metrics on that?
Yeah, I've seen
ROI?
some of the organisations we've worked with. So for every £1 you spend, it's anything between £2 and £34 return. So it can be absolutely huge, and the real enlightened and commercially minded organisations are the ones that are seeing that and investing in that and understanding that.
Yeah, and I think it's taking that strategic approach where you start to see those real return on investments. So if we just purchase an EAP or just train mental health first aiders, I like to call it the sort of bags and bananas brigade, really. So it's all very, very tertiary. Where we invest in those, and there's nothing wrong with investing in those, then we don't see returns on investment. We're not able to measure any real return on investment. But where organisations take that strategic approach and look long term and assess where the need is first and what's going to work in our organisation, where are the hot spots, where do we have the problems, that's where, when you put the interventions in to match the hot spots, that's where you start to get those returns on investment. And so there's more and more figures coming out now, and they're all around that sort of figure, aren't they?
I think also there's things that you do struggle to measure. Discretionary effort, the extra that you get from staff. We're not talking about people still sat at their desk at 8 o'clock at night. We're talking about people who are actually invested in what they're doing and are managing themselves, take that responsibility individually as well as the organisation doing what they can to help as well. So there is obviously ways of being able to measure the return on investment, but there's also things that are more difficult to measure, but actually do have a huge impact. There's
I should say that there's a feature going into the next issue of IOSH Magazine, along with the write-up of this roundtable, that from the chair of the EAP Providers Association on their calculator for measuring return on investment, and there is something about discretionary effort in there. But I think again, line managers will tell the organisation when they're seeing that kind of thing. If you have a kind of sense of a good corporate culture, people know when people are working really, really well, don't they?
It's the qualitative stuff, isn't it, that doesn't fit in a box. That managers will say will see the difference in how people are responding and how engaged they are with what they're doing, and that kind of good stuff really that doesn't fit in a box, but actually everyone can recognise it's happening.
Yeah, it's the same with presenteeism, isn't it? So that's exactly the same. It's so hard to actually measure. And we've got some indicators we use to try and do that, but yeah, it's very difficult when somebody's just sat at the desk and they're physically there, but they're not really performing.
How engaged are they in what they're doing?
Yeah.
I think engagement is a key factor here as well. So I think that employers should be measuring more. I mean, I know some do, but the statistics for the UK are pretty bad as well, aren't they? If you look at it, it's something like 11% of employees say they're actively engaged with work versus 21% actively disengaged. And you're looking overall, 89% of employees disengaged with their work. It's not a good statistic, is it? So.
And I think a lot of the work we've done that said, ask people, why have you put a health and wellbeing strategy in place? It's very much around the vast proportion is to improve employee engagement and to improve organisational culture. It's much lesser around sort of the tactical and fiscal piece. So yes, you have to prove a return, but that is a much more holistic return to show those engagement scores moving, to show that culture being driven towards that high-performing organisation. And it really has to link with what your organisational objectives are. What are you trying to be as an organisation? Therefore, what sort of workforce do you need? Therefore, how does your health and wellbeing strategy link to that? And every company is different. You can't parachute somebody else's health and wellbeing strategy into your own.
No.
You need to do some work to understand it, and that's where the real, as Karen says, the real gains can be made.
So where would you start?
For me, I'd look at the vision, look at your company vision and your company organisational objectives. Where do you want to be? What data do you already have about your workforce, whether that's from exit interviews from people who've left, whether that's from engagement surveys. Look at what the competitors are doing, look at where your gaps and benefits are, and then write a strategy on that. And it's ensuring that you can meet everybody's needs, so it's within that strategy, making sure you know what budget you need, but also what you're going to be able to measure and give back, so people, and that's both employees and management, particularly finance guys, but can see those benefits. It's very much starting with looking at your organisation. Where do you want to be, and how do you take that journey?
And you can actually benchmark at that point. So we quite often we have an indicator called stress factor that we use with organisations that helps to just understand where the organisation already is. So taking all the data, as you said, that they've already got, but then saying, well, where are your hotspots? You know, where are the people that are most stressed within your organisation? And are there any specific needs within that strategy for them? So yeah, there's so much groundwork that we have to do before we get to that point of actually putting in place the intervention. It's almost the start of the intervention, is that vision.
I think I would. We go into organisations and have a way of working that's called tribe, and part of that is trying to kind of understand all the different things you've just spoken about, but also from the senior team, what is it that they think is going on in the organisation, and then we talk to people who are actually in the organisation, and often there's a bit of a rub there. There's some tension between what they think and what the people who are actually in the organisation think. So I think part of this is about not imposing something onto people without their engagement, because you can put things, and we've all probably worked in organisations where things have been put in place and you're supposed to engage with that, but actually it doesn't fit with what you think or how you feel or how you believe, you know, what you believe. So engagement for me is the core beginning point, where what is it that the senior team are saying, what is it that the organisation and people at different teams are saying, and what areas are there that can be developed and thought about in a way that might be some very quick wins, you know, some things that can clear the path for people to do their job far more efficiently, and there might then also be a strategy, training, whatever else that goes with that you know can kind of help people over a period of time, rather than something going in and being like, this is what we're doing. It needs to be something that people evolve into.
I think that's a key point, isn't it? Is you're trying to embed a culture of wellbeing. And you know, you asked the question, where do you start? And I think a lot of organisations don't really know that, and they run initiatives, or they say, oh, you know, we've noticed more people are stressed recently, therefore let's give everyone some stress management training. You know, let's get our line managers trained up how to notice signs of stress, and it's okay for maybe a week or so, and it's fresh in the mind, but very quickly it's forgotten, and as people come and new people come in, you know, then it's forgotten, and it's because the organisation hasn't decided. You know, this is not something we do in the short term. This is who we are. This defines us now, and we're going to get a wellbeing culture in there. And I think that's the first decision that you have to make. Is that's what we're going to do.
Yeah, I think you've got to come away from that idea of people go on a training or they take part in something, they get a certificate for it, they put it in the drawer and they carry on as they did before.
Or people don't know where they kind of if they're supposed to be points of contact in the organisation. There's no list published of their names. There's nothing to flag them up. Yeah. You know, it's not. We're not here to talk about mental health first aid as a discrete topic. But I'm a first aid. I'm a fire marshal, and I have a high vis jacket that sits over the back of my chair. It's in a lot of organisations, because it's seen as a very discrete thing. Mental health first aiders aren't actually signalled to anybody.
I mean, I was in a local authority recently, and they had, you know, they've got physical health champions, mental health champions, you know, but there wasn't any cohesive approach. Like, there's a pocket of people over there, and there's a pocket of people over there, but if you don't know who they are, you've no way of finding out, and so everything has to kind of. That's why the strategy is really important, because then you communicate it on your intranet, you communicate it in your meetings. You know, it's part of what's happening in the culture, and people then know who to go to if they're struggling. And mental health first aid definitely has a place in that strategy, but you really want prevention, really, rather than cure, and that's what wellbeing is all about.
And I think workforces are so complex these days, especially in terms of the types of people that work in. We do a lot of work on multi-generational workforces, and you can have some organisations have 5 generations working in a workforce. And what
that's only going to increase.
Completely. And what a baby boomer might need from a health and wellbeing strategy is very different from what a millennial might need, and it's understanding, and it's going in and asking and engaging. And being agile in adapting the initiatives.
I should say, when I say it's going to increase, I don't mean there's going to be 6 generations of people working in companies. I was thinking so there'll be more and more companies where you are looking at people who are coming out of school and people who are well past what we think of as current retirement age, which has got to be a good thing. But on the other hand, they have completely separate, but certainly physical priorities and needs.
Yeah, very much so.
Yeah. Can we talk a little bit about the quick wins that you mentioned? What do people, assuming that you have a strategy and you've decided that you know there will be things that are very specific to your workforce, but there is only a certain number of components that you're going to put into a program. What are the early ways to get people to engage with a health and well-being program? What are the quick wins?
I think one of the first things, once you've established a strategy and you've understood where and you've spoken to people, and what worked for us was having both health and wellbeing champions across the business, as well as mental health first aiders. So we did the mental health first aid training, and that is very much embedded. But we also had health and wellbeing champions across the business who were also point of contacts, perhaps on a bit more on a wider basis. And they made themselves known. They went to team meetings. We did a lot of communication on these champions. And one of the early things that people would just picking up on was the fact that many of our colleagues had teenagers who were very stressed, and that was then stressing out their parents who were coming to work stressed. So it's nothing to do with work and that individual person, but their family had such a bearing on it. So we just developed a really high level toolkit for dealing with teenage stress, and we put it out on our intranet and around the business. And again, that had a real effect of A, we listened, B, we did something about it, and we were doing something tangible about it. So that was very specific to our organisation, but that worked really, really well.
Yeah, and I mean another quick win can be something that we've used often is what we call like a high impact wellbeing day. So right at the beginning, when you've set your strategy, set your tone, to make a really big fuss about it, and to have a day where everybody, almost like a safety stand down day, but a wellbeing sort of stand down day. So all employees are invited, and there's people giving presentations and talks, and there's little sort of pop-ups all around where people can go and a lot of those pop-ups are, yes, they're the bites and the bananas, they're the tertiary interventions, but people like to be able to go and have their blood pressure checked, and let's check what my weight is and height, and so all of that, I think, creates that buzz, and it allows people to start to engage with the strategy. So although we've engaged with them at an earlier level, as you said, with thinking about the strategy, it's engaging with them again at that level, and they like it. They feel valued, they feel cared for. It's not addressing the root causes of the problems, but I think it's a quick win at the very beginning to get people bought into this whole idea of creating well-being.
I think that's also building on trust, isn't it? Because that's what we're talking about, that people can trust the organisation, do actually care, they are invested in their well-being, and being able to kind of celebrate that, I think, at the beginning is really important. I think some of the other quick wins that I've found just in the work that I do is that sometimes it's things that you would never even imagine. Irritations that people are working with every day. That could be the frustration that their computer doesn't work as quickly as they want it to. It could be that their chair isn't comfortable. It could be the environment they're in, their office space. Those are the things that when people are sat there day after day, or they're out there doing a job, that's quite stressful when things don't work in the way that they need to. So, absolutely agree with what you're saying. And sometimes it's those things that people will say and think, well, we can do, that's minimal. It's minimal time, minimal cost, we can sort that. And again, it means that people think, oh, actually, you are paying attention to what's important to me. And then, again, you build on that. So you're clearing the path for people to be able to do their job in the best, most efficient way possible.
James, did you have anything to add on quick wins?
I mean, one thing I think that works really well, and it has to be something that's driven from the top, but is to decide to trust your employees as well. You know, a lot of stress is put on people because they're not trusted and they're checked up on too much. You know, and that might be in terms of things like a flexible working policy, or not being too rigid about the hours people keep in an office. And another thing I think that works well is, again, it's driving it from the top, but it's putting someone really senior, maybe the CEO is the right person for this, to front such a campaign, you know, at the beginning, and say, we're serious about wellbeing. You know, I think that can drive engagement quite quickly at the beginning when they realise it isn't an HR initiative, or it isn't, you know, another manager, it's actually the CEO of the company saying, I take this seriously. Yeah. And we're going to drive it through the organisation.
It absolutely has to come from the top. If the people in the top of the organisation are not on board, don't see the value, and I know there's always going to be some people who don't fully see the value, and you know, the culture of the organisation is sending emails at 10 o'clock at night, even though we're saying we want your work-life balance. You know, you've got to be able to live it and show that that's what you're committed to. And I think if the leaders in the organisation don't see the value and see it as a thorn in their side in a way, you're never going to make the shift. No. Because it'll be implemented, but it won't have the motivation to keep it going forward.
That's why you have to kick off, don't you, with that board level engagement. If you can't get to them or get to a significant number of them, then your wellbeing strategy is going to fail in the long term, isn't it? You've just got to have that buy-in, and as you say, them, really showing the behaviours that we're expecting from our
challenging people who don't, I think, is another part of that.
And being authentic, I mean, it has to be. You can't just
you can't
pay lip service to it
very quickly. You've got that smile on your face.
You
say something different.
Very much so.
Well, the directors or the senior managers are the people who are going to continue to vote funding for anything that you do anyway, and so they better be on board. Otherwise, it is just a temporary thing, isn't it? I think I was just coming back to something Alexis was saying, that this, the kind of the value you get from any program that takes off, that from particularly where it's talking to people about the things that they want, whether it is people sort of complaining about their workstation that kind of they didn't feel they had a route for before, or nobody was listening to them. You do get when there's a real energy around some of these campaigns that brings up all sorts of subsidiary things that is really valuable, I think, isn't it? Is that you get to sort other things as an organisation because people feel that they're being listened to and that their opinion matters. There's definitely value in that.
I think sometimes there can be really circular conversations that go round and round, and people, it's quite toxic. Because those things actually become something that's a sticking point, and they probably haven't even told anybody really, but because that hasn't gone any further, there's a sense of, well, we can't influence it, where people feel they can and they've got some autonomy within that. And you're right about that kind of micromanagement. If people can let go and lead really, and let people kind of be able to come forward with things, then that shifts the culture automatically, because people feel more responsibility and more ownership in what they're doing.
Yeah, I think that trust issue you raised is a really, really important one, and it's central to it really, because so many organisations still don't, underneath it all, trust their staff, and that's why we don't have enough flexible working from home, all of that, because the message that sends is that we don't trust you, isn't it? And that is picked up, and when you start to run sort of focus groups or discussion groups with employees, that often comes up. Well, we're not trusted because it's assumed that if we're working from home, or we come in late or we go early, that we're skiving. But we're certainly not working and being productive.
It becomes very transactional, doesn't it? Like, well, you don't do that for me, so I'm not doing that for you. And you become to that very kind of childlike behaviour around withholding. The employee starts to withhold, and management does as well. And there's always going to be a gap there. It's never going to work. It's never going to work for the organisation. That's never going to have a good outcome.
Any kind of initiative, any kind of employment initiative, has to fight with everything else that is the senior executives have to fund this year, any year. Can we talk a little bit about making the business case for health and wellbeing? It's not that we haven't been so far, but specifically about where you would go for data and and what you would base a business case on. James, do you have any?
I mean, if I'm thinking about the British Safety Council now, the business case fits quite nicely with our vision. You know, and we recently changed our vision. Our vision is that no one should be made ill. Sorry, no one should be injured or made ill through their work, and that's a recent change because it used to be at work. And when I realised actually no, that applies equally to home life as well, because we may be adversely affecting that. So from our point of view, to say that we need to invest, you know, in the well-being of our staff is quite straightforward, because it fits in exactly with who we are. And if we can't be that ourselves, how can we expect to influence anyone else, you know, in the sectors we work with? But in terms of it kind of depends on what drives, you know, the people that are approving the business cases. Are they purely interested in bottom line return on investment, or are they willing to look at other things? You know, I mean, anyone who's studied health and safety can reel off 3 reasons for managing health and safety, and those 3 reasons apply equally to well-being as well, don't they? Really. So you've got the moral side to consider as well.
Yeah, and people forget that, you know, under health and safety law, employers do have a responsibility to manage the health as well as safety. That includes stress. That's, you know, it's in HSE's 2020 strategy. It's one of the key strands that they're focusing on is work-related stress. I don't like the term work-related stress, but they are focusing on stress and on musculoskeletal disorders, and we know that a big proportion of musculoskeletal disorders are potentially stress-related. You know, it's that vicious circle between the two. So in terms of a business case, we can pull out all the facts and figures from research that shows the return on investment, but also employers should be doing it. It's pure and simple. We should be doing it. I don't think we should be just focusing on stress as HSE does. I think well-being's broader than that. But if we create well-being, if we do the strategic stuff that we've been talking about, then we're satisfying our responsibilities under health and safety law anyway. But I still talk week in, week out to people who somehow don't accept that they need to be doing it legally. They should be doing it, and that the inspectors will soon be out there.
That's not a business case, though. That's not.
It's not a business case.
It's not, because and this is the thing, is that I'm advocate here for the health and safety manager who is trying to make a case to people who really only care about the things that they absolutely have to care about, and even kind of may not, that they'd never admit it, want to fund interventions that would prevent minor accidents because they could cope with the eventuality of a fine if it ever happened. Or, you know, if you wanted to make a case to them to work with the stress management standards, because the HSE supposedly has a pro forma enforcement notice for stress now doing the rounds inside the HSE, then that's using the kind of compliance argument. But beyond that, you know, you have to be able to talk the language of business to get the funding for these things. And so I think if we come back to the moral argument rather than the business case, we might risk leaving some of those people a little stranded.
Loads of different figures, but £8 billion a year lost to absenteeism, 16 billion lost to presenteeism. And you start to break that down by companies, just the cost of a day's absence. The figures are they're actually quite easy to prove on that.
There's figures that show
definitely.
that well-being, investing in well-being is a wise business decision.
Yeah. That makes it difficult though in some ways, because the stats are out there, but does each company know to them how much money they lose? And if they haven't done that, then it's sometimes difficult to show to this individual company what your return on investment is. How can I prove to you that you've saved this much money, you know, or you've retained talent better, or you're having less presenteeism? Perhaps that means an increase in absence rate, but also maybe an increase in productivity. You need to be good at measuring those things beforehand. So if someone says, can you write me a business case, it may take quite a long time to go away, do that research and come back with some meaningful numbers.
And also looking at, you know, attrition. Most businesses aren't that great at doing their, you know, when someone's left, I can't think of the name of the interview, but you know,
exit interview.
most people aren't aren't that good at that. They're not that interested really. And when we go in, we talk about, you know, what's your absenteeism, what's your disciplinaries like, you know, those things that show that people just aren't happy or aren't making very good decisions. You know, we go in and do mediation work, you know, because the relationships are breaking down. So there's lots of, in terms of a business case, if I can say, right, okay, well, there will be an improvement as a result of this, and also, you know, here's evidence from another organisation we've worked in, it makes it, they can apply it more. Yeah. Whereas when we look at the general figures, absolutely there's a case, you know, it's absolutely evident, but people, I think, still think, well, that's not my business. Yeah, that's not going to happen to me.
No, but if you could find an organisation, because somewhere in your organisation, if there's more than kind of 50 employees, someone is measuring, someone can look at the number of days that you've recorded of sickness absence and calculate a rate for you. Yeah. And then if you take that and turnover and you find the evidence sort of from case studies of organisations that have introduced policies, and there are often before and after rates for absence and turnover, and even productivity, that you know, a lot of organisations don't really measure that properly. Yeah. Then you could make kind of comparable things if you were making a business case to your own board.
And that's the research, isn't it, that you do beforehand. Or if you've got, you know, health and safety managers or HR managers that are on board with creating that case, they'll be measuring those things. Or you might have to measure those things over a period of time to create the case. Absolutely. Yeah.
And also, once you layer on that the cost of recruitment, so actually as people, if you're losing good talent because you aren't looking after your employees, it's a costly business to go back and recruit them. And actually people, you then layer on top of that again, if you want the best talent in your business to be the best business you can be, people are shopping around, particularly millennials now. They are looking, they're not just looking at the benefits package. It's all around what's the culture, what's your how do you look after people, what's your engagement, and then they will act accordingly. So it's a much more mixed picture. And so I think, I mean, we go in with businesses and help them write the business case, because we recognise it is critical. And you can see it, there's about 8 or 9 key measures that you can, some more tangible than others, as in anything, but it's relatively simple once you get under the skin to get that business case.
Sure. Yeah, and we, as I mentioned before, about the stress factor that we use, and that often we're able to, from that, work out a potential loss in productivity. Yeah. So by measuring the hotspots, by looking at people's sort of stress levels, how they're performing, their levels of engagement, we've actually been able to put figures on that. So we've been able to say, these are the people you've got in your organisation. It's almost a measure of presenteeism, really, because these are the people that you've got in your organisation, but they're actually not being productive. Yeah. And this is potentially how much money you're losing every year because those people aren't engaged and they're not well and they're not healthy. So again, that's something that you can use, and then you can look at again in 2 or 5 years' time, and you'd expect to see a massive improvement.
Sure.
Another thing, just thinking about, as you were talking there, is about how they use appraisal systems in their organisation, because that can also give you an indication of how invested people are in their people development, whether people are engaging with their objectives, whether they are doing blanket objectives across the organisation or making them individual, who's engaging and who isn't, you know, all of those kinds of things, which is all recorded on an annual basis, so you can get a picture of that across the organisation as well.